Hello everyone. Today we are talking to you about why your back always hurts. I'm Dr. Janae Brown.
I'm Dr. Miley Bay Hawkes.
I'm Kristen.
And we are 3 clinicians at Physical Therapy San Pedro. Our body is pretty amazing and it's resilient and it's forgiving, and we ask a lot of it, you guys, right? For the most part. We find that when we're young, we're active, we're participating in sports and PE, and we really stay pretty mobile and active for the most part. And as we get older, we have to be really intentional about building exercise into our lifestyle. Some of us are really, really good at that. We exercise daily, or you have a good exercise regimen. Oftentimes it depends on what season you're at in your life. If you're a parent, if you're single, if you're motivated on getting some weight off, if you're training for a marathon. There's a lot of different reasons why you might be better at this. Up and down. But you still have to be really intentional about building exercise into your program. And when you're not good at keeping activity in your lifestyle, you can have constant back pain. But there's really more reasons than that. We feel like as a group, we see several reasons why you might always have back pain. So today we're going to explore that together. We're going to talk to you about some of our top reasons why we see that our patients in particular always have back pain. And we want to give you guys some tips and some things that you can take home and work on your own, and maybe identify if you need some help. So, Dr. Bay,
Yes.
give me a couple of reasons that you find that patients might always have back pain.
Definitely. The number one reason that we all feels very important is that your back might be weak.
Yep.
Nothing is more important than a strong body. Seriously, nothing is more important than a strong body.
Yeah.
We need strength to combat all the stresses of our daily life. So that means whether it be the sport that you're doing, you need to have the appropriate strength for that. If it's caring for yourself, caring for your loved ones, whatever job or work, career you have, they all come with their own set of stresses, and we have to be ready to fight back against that, plain and simple.
Yep.
So, that, like Dr. Brown just said, when we're younger, we tend to have come off a lot of activity, right?
Yeah.
As kids, we crawl around and
Yeah.
climb. In school, it's built into our day, but we may fall off of that.
Yeah.
And the big thing to know is that after the age of 40, we start to lose our muscle mass. So you cannot just rely on your past history anymore of being very active. You have to actively fight this aging process by doing your isolated strength work, your full body strength work several times a week. This is very important. It just can't be skipped, or else at some point everything that felt good your whole life is going to start to break down somewhere. Unfortunately, we see it all the time.
Yeah.
The other really big thing I see is that when it comes to injury, whether it's an overuse injury or a trauma of some kind, those who have participated in their strength work regularly get better quicker, and their injuries seem to be less severe. So if that can't motivate you, I don't know what will. That's very important. Get better faster, get less injured.
Yep.
Big deal.
Absolutely.
Okay, number 2 is you lack flexibility in your muscles. So, lack of muscle flexibility takes a huge toll on the spine. Our low back, our lumbar spine, is an area of our body that craves being really stable. It has certain amounts it should move, but we typically want to get more movement above and below.
Yeah.
So, when these muscles lack their movement, the lumbar spine is asked to undergo way more stresses than it's really supposed to do in the typical balance of our body. So when we break it down, the most common players in this would be the muscles in the front of our hip flexors. They make our back extend too much when they're tight. Our hamstrings, when they're too tight, when we go to bend, it puts too much of a flexion or a rounding stress on our back. A lot from our shoulders and scapular muscles, when they can't move and get us into better postures. Again, huge stresses on our lower back.
Yeah, absolutely.
All right.
Cool. So Dr. Bay covered that your back is weak. That might be one of the reasons, and you lack flexibility in the muscles around in your legs and back and all around. Flexibility is the issue.
Yes.
Kristen's going to go over a couple more for us.
Yeah, so people often get confused with the difference between mobility and flexibility. So flexibility is what Dr. Bay just touched on, the ability for your muscles to be able to stretch and contract. And then mobility is going to be your joints' ability to slide and glide and roll and articulate to get you the range that you need in order to do functional movements such as upper body, pulling, pushing, reaching, lifting. So if you don't have that mobility in your upper spine, for example, then you're not going to be able to fully extend your shoulders and do what you need to do with your upper extremities. So it's really important to keep your mobility up as well as your flexibility.
Yeah. And some of that with the mobility is like, you know, if you're in postures where we're forward, and we live in those forward worlds, right? That if you don't have the mobility to get into extension, or if you don't have the mobility in your lower like pelvis, right? To like, if we're sitting like this and you're rounded in your pelvis like this and you don't have the mobility to get into extension, you might have pain in your back because you're lacking the mobility like in the areas above and below the spine that really need it. So you lack mobility. What else?
Right, so also, you know, your posture may just suck. So
Sorry, your posture sucks.
Yeah. So you may be doing, you know, everything right, you think. You're prepping your mobility, your flexibility, your stability of your spine, your strength you think is good, and you're still having back pain. So then you got to look at what you're doing the majority of the day and how your posture is. So if your posture is bad for prolonged periods of time, then there really isn't anything that you can do to counteract that other than being more aware of your posture. So I would say that if you're in a prolonged posture, whether at the computer or just standing, rounding your shoulders, to take some breaks and just counteract that and try to get out of that habit of staying in this kind of anterior placement.
Yeah, for sure. Yeah, the posture is a big discussion. We were chatting about that before we started this, and it's really, you know, posture is one of those things that being in a posture is not a problem of what we call a bad posture. What is a bad posture? But a prolonged posture, what Kristen said, can create dysfunction in your body. When you have prolonged postures, your body doesn't like being in one position for a long time.
Definitely.
And that's where we have problems. So let's not get it confused with, you know, good posture, bad posture, all that.
And you are allowed to
Jargon.
move.
Yes.
We're not always perfect.
That's right.
We can leave our
Sometimes-
posture, go other places, but
Nothing for too long.
Yeah,
Yes.
we can rest
Don't overdo
in
it.
postures, but we don't want to do anything for too long. So I'm going to talk about two more, three more. And so the first one I'm going to talk about is that you're doing the big stuff, but you are not doing the small stuff. So you're neglecting the little things. So you're strength training, you're working big muscles, you're working out, you're lifting, you're potentially, in your sport, you're maybe doing a lot of skill training for dance or ballet, or you're doing these big things that are really important for whatever you want to do. You're running, you're doing those things, but you're not doing the little things that are going to help you with the big things. And so we see that a lot where you just need to build some of the mobility and some of the flexibility things into your warm-up, 10 minutes, 5, 10, maybe 15 minutes of stuff. Those things are gonna help you feel better for these big things that you're asking yourself to do. So don't neglect the small stuff. The small stuff matters, it works, and it really helps us feel better. So make sure you're doing a proper warm-up. If you don't do that, your back is gonna always hurt, okay? So the other one that I'm going to cover is overtraining and overloading. So those kind of a little bit go hand in hand, but what we find sometimes is, you know, people move their weight, or they do things too quick without giving the body time to develop a chronic load, okay? So this is what we call kind of the weekend warrior. I'm going to deadlift this week, and I'm not going to deadlift for 4 more weeks, and I'm going to try to go back to the same weight I deadlifted today, and I didn't do anything else in between. So, or I'm gonna try to spike that weight really fast.
Yeah.
Maybe I start deadlifting, I haven't deadlifted in 3 months. I'm gonna start deadlifting this week, and then I'm gonna do it another time in 3 days from now. And in 3 days from now, I'm trying to take my weight up significantly from where I was 2 days ago. And that's a problem, right? So you gotta build some chronic load, right? You gotta slowly build. Yeah, you can't just go back and forth. So overloading too quick is often what we see a problem, and that's going to create constant back soreness. Like your back is going to there's going to be micro trauma in your back that comes from that repeated poor stress that you're asking your body to do. So don't do that. Don't overload too quickly. Don't overtrain too much. Too much of one thing is not good either. If you're doing upper body work 3 times a week, and not doing any lower body work, that's a problem. Like you need to have balance in your training as well. So overtraining to one thing or overloading is usually a problem.
Definitely.
Yeah. And the last one is recovery. And recovery is just something that we're all not good at, so especially athletes. So you need to have a couple days of recovery built into your programming. If you're training and you're working out, and this goes back to more of our athletic population that's working out every single day, maybe 7 days a week, or doing some sort of training every day. You're taking 7 dance classes, one's contemporary, one's, ballet, one's jazz, tap.
Partnering.
Yeah, every day is a different dance class. And you're like, okay, well, when do I rest, and my ankle hurts or my back hurts or whatever, right? So you need to build in recovery. Our body needs time to sort of take a break, relax, rest. I mean, rest is the best recovery, but you need to stop, right? And recovery could be resting, relaxing. It could be, getting a massage. It could be
ice
bath.
Foam
Epsom
rolling.
salt bath, foam rolling. But it's just stopping,
Hot
right?
tub.
Yeah, exactly. Build in some recovery into your life. So that was our last one. Dr. Bay, wrap this up for us. Tell us, okay, they have all this information. They know some of these reasons. What do they do now?
Right?
Yeah.
So knowledge is power. We just went over 7 major common causes that people experience constant chronic low back pain. So you have the tools now. Take a look at this list. See if you can identify 1 or more areas where you can make some changes into your weekly program, right? So here you go. You're gonna figure out, okay, do I need to do strength in certain areas? Do I need to work my mobility and my warm-up more, right?
Yep.
Then we're gonna take it and we're gonna say, okay, I'm feeling better now, yes. Or, hey, I did this and I'm confused, or I was not able to make the changes I wanted. Then that's when you reach out.
Yep.
We are always here to help you, whether it's virtually or in person, because remember, as always,
we got your back. So we got your back. Yeah. You can also check out our Instagram, our Yelp, Google, our website to read the full blog. We're going to be actually going live and talking about this as well. So tune into all the avenues that we have here for you. And we will see you next time. Bye.